Okay, let's unpack this. Imagine this. A developed country, right? Family planning is like a recognized human right globally. But then locally in Malta, there's no official policy, no real national data. Basically, very little idea what people are actually doing. It's quite a situation.
It really is surprising, and that's why this deep dive is so interesting today. We're looking at a 2022 master's dissertation.
Yeah, by Francesca Fenech Conti, University of Malta. It's literally the first proper study giving us a crucial look, finally, at contraception practices among Maltese women.
And what's fascinating, I think, is how it immediately shows this gap, between the big international rights ideas and what's actually happening day to day for people. It's giving us insights we just didn't have before into reproductive choices. And it really shines a light on how, well, socioeconomic stuff and culture are all tangled up in this.
Definitely makes you think about what reproductive justice really means on the ground, doesn't it? So here's where it gets really interesting with the numbers. The study surveyed over 2,500 persons assigned female at birth, mostly highly educated, tertiary level.
Right.
And it found, right, 76% are using some kind of contraception, which sounds okay at first glance. But then dig deeper. A huge 58% rely on less reliable methods. We're talking withdrawal, condoms.
Right, the traditional or barrier methods, which have higher failure rates.
Exactly. So only, just over a quarter are using modern, more reliable options like the pill or IUDs.
Just over a quarter.
That 58% figure, that really jumps out. It feels high. What's the biggest misconception this study kind of blows up about contraception there?
Well, it's a great question, because I think the biggest one it tackles is this idea that if people are highly educated, they'll automatically use the most effective family planning.
Right. You'd assume knowledge equals effective use.
Exactly. But this study shows, it doesn't, this reliance on less effective methods, it's not just about not knowing. It actually reveals how deep these cultural norms, like religiosity and also system barriers, how they can override even high education levels when it comes to making these personal health choices.
Okay, so if it's not just a knowledge gap, what are the reasons? Why are people leaning towards these less effective options? What did the study find there?
Well, a few key things came up. The research did find a significant link between religiosity and choice. Women who identified as religious were more likely to use traditional methods.
Okay, so religion is a factor.
It is. But then there's this other piece. A quarter of the women surveyed said they weren't using their preferred method, even if they knew about it.
A whole quarter? Really? Why not?
The reasons they gave were often things like the cost of modern methods, fear of side effects, which is common, and sometimes just, not knowing where to actually get them or where to get good advice.
So it's cost, side effects, and access issues.
Yeah, it's this complex mix. Beliefs, money, and just the practicalities of the system.
And the impact of all this, I mean, the study estimated unintended pregnancies could be somewhere between 23% and maybe even as high as 47%. That's sobering.
It is incredibly sobering, especially when you remember the context.
Right. In a country where abortion is illegal, no exceptions. The study actually documented 101 abortions among just this group of respondents.
And on top of that, a high rate of miscarriages, too. 28% of those who'd been pregnant reported having at least one. It just highlights the personal toll.
Absolutely.
And if you connect this to the bigger picture, it really starkly shows how these societal norms, the culture, and crucially, the lack of supportive policies and easy-to-access services, how they really constrain a person's ability to make their own reproductive choices. Even with good education, like we saw in the sample, these barriers are still there.
Yeah.
It really underlines the need for change at the system level, not just telling individuals to be more aware.
So wrapping this up, what does this all mean for you listening, or maybe for Malta itself? I mean, this research feels like a really powerful call to action, doesn't it?
It absolutely does.
A call for Malta to finally develop a proper human rights-based family planning policy, something that's backed up by decent funding for research and, critically, services people can actually access.
The data is there now, thanks to this study. It provides that vital evidence needed to push for policy change. But maybe the provocative thought to leave people with is this. You have high individual desire for family planning. People know methods exist.
Right.
Yet you still see this reliance on less reliable options, high rates of unintended pregnancy. So what does choice really mean in that context? When these external forces, culture, cost, access, policy, or lack thereof, are still shaping personal decisions so heavily, what does real, genuine choice actually require to flourish?